We got a code brown. Welcome to Bedpan Banter. With me, Nurse Mike,
the daddy of nursing.
Can I get a bedpan over here?
Welcome back to another episode of Bedpan Banter, the official podcast of Simple Nursing, where we chat about the human side of healthcare and really all things nursing. I'm your host, Nurse Mike, and today we're diving into the unfiltered, hilarious, and sometimes shocking side of nursing. We're going to be talking about some of the craziest stories that I've experienced as a nurse and also some stories that you guys sent in. So big, huge warning here. If you're eating lunch, you maybe want to save it for later because there's going to be some interesting stories that could be a little bit gross and may even make you spit out whatever you're eating. All right, so let's dive into some crazy stories from my experience as an ER nurse. So I have a lot of stories in the emergency room, but there's some gory stories, there's heartfelt stories, but there's also even smelly stories. But I have a few that come to mind that really make the top of the list. One patient came in with abdominal pain, and we're like, okay, that's fine. As we're taking the assessment, taking the vital signs, everything checks out normally, but he's just in like massive abdominal pain. And we're trying to get a history of like, what really happened? Like, what, do you eat something? Like, what's going on? And this person or particular individual fell on something. You know what that means. So we go right to the x-ray room to see what he fell on. And it turns out that he fell on something pretty big, pretty massive. He fell into something really huge. So it ends up being something that, penetrated very deeply into his crevasse, his anal cavity, or basically rectum. It turned out to be around 13 inches in size, and it was pretty massive. So anyways, we had to have a lot of extra hands on deck, let me tell you. Usually these patients will actually go to the operating room, right? Because if you guys didn't know, the rectum actually has a reverse suction. So if you're taking, let's just say like a temperature, a rectal temperature, and you pop out the sleeve, that rectum will like slurp it right in. It's like, beam me up, it's going in. And that's exactly what happened to this thing that our patient fell on. So before contacting the operating room, because they have to like literally go in, sedate the patient, and then like with instruments, I don't know how they go in there, but they have to grab it out. So the doctor comes, and we have like a Russian doctor with, I think he's Russian or some type of Eastern European that had like a thick accent. And then I still remember it. We even say it still. He's going in. He's like, okay, let me see if I can get it. And he's like a little, this kind of prong approach, a little Ninja Turtle hand. It's like going in, trying to grab it. But the risk with that is that you can actually push it in deeper into that rectal cavity and get it slurped in even, into the colon, which is really bad. Because the patient could have like a SBO, a small bowel obstruction, that can perforate and then lead to peritonitis, infection all over the, peritoneal cavity, and the patient can go septic and die. So it's really, really crazy. So we're going very gentle, very smooth, trying to get in there, making room, kind of loosen it up, like loosen up a really tight jar, and getting in there. And there's like a few nurses like around. We're all like, in the bleachers spectating. I wish I had some popcorn. No, but all hands on deck, but only one hand in that cavity. And so the doctor's like, and we still remember this quote today. It's like, he's looking in there, and with his accent, he's like, wow, it's big. It's really big. He's like, he ends up making contact with this beast inside this patient. And is able to actually, I don't know how he did it with the Kung Fu grip or whatever. He just grabbed it. I think he used to rock climb because he had a really good grip. He grabs it and is pulling it out. And as he's pulling it out, I think he says it a few times because we still quote that to this day. It's like, wow, it's so big. And the nurse that was closest to the action, pulling it out, like, as they're retelling the story, they're pulling it out, and then she's like, thud, like a baby iguana hit the bed, like, thud. And then I'm on the opposite side trying to hold some cheeks open just to make sure that, we're trying to get this thing out of this patient. And it ended up coming out of the patient. No OR, which is great because that's a whole deal. And you have to like call the surgeon and everything. I have the whole OR team. That's pretty embarrassing as well. But the funniest part of this whole thing is the patient wanted to take his toy home with him. So we actually had to get a belongings bag and put it in there, kind of like a to-go bag, or like a souvenir. Like, thanks for stopping by the souvenir shop at the ER. And then He's like literally walking out of the ER with his discharge paperwork and this like bag that's kind of like slapping his shoulder as he's walking out. So that was pretty wild, but just a normal day in the ER. So moral of the story is don't fall on things. Make sure that you have good balance and always keep your friends close, but your enemies closer. All right, but enough about me. Let's get to the stories that you guys have submitted. First up is Greta Young. This one, like, oh, as a male, this like really made me cringe, but I've seen it before. Greta Young says that she walked into a patient's room only to find that the patient pulled out his entire Foley with the balloon intact. And you guys know how big those balloons are because those balloons are supposed to sit inside the bladder and prevent it from falling out, right? So imagine pulling that huge balloon all the way through that tiny urethra. Like my dad had a kidney stone, and he was saying like that was like childbearing or childbirth, whatever. It was like very painful, and kidney stones are really small, like usually like pea size. Imagine walnut size going through that urethra or basically that pee hole, just like whoop, like oh my gardens, that's gonna be really whoo oh whew. Okay. All right, this next story is a nursing school story from Emma from New York. Our teacher is a very unhinged person. Oh, you don't say. Sounds like the normal nursing instructor. No, I'm just kidding. Okay. She once changed this kid's, that's so funny. A lot of New Yorkers call people kids. This kid that she openly didn't like, changing their grades to zeros just to freak him out. But everyone knew it was an April Fool's joke. All right, so that's pretty mean and pretty sinister, very unhinged. I've never heard of that before, where an instructor would pull an April Fool's joke like that. But yeah, I could definitely see that as being like very shocking, especially in nursing school when everything's stressful. All right, this next story comes from Brandino from Chicago, Illinois. I was interviewing and said the worst thing you could say during an interview. Ooh, this is juicy. And of course, didn't get the job. Okay. So I'm interviewing with the observational unit at my current hospital, and wait for it. I told the hiring manager that the department would be a great fit for me because it was a slower pace. Uh-oh. You do not say slower pace, because that's when things really hit the fan. Especially if you're going on to unit and dropping off a patient. Or in the ER, we never say that. So Brandina says, why did I say that? She broke it down for me and was pretty much like, this department can get slammed at any given time. So the talent acquisition called me and asked me how I think the interview went. I just knew I didn't get the job, and she was like, yeah, you didn't. And I wasn't even upset because I knew I bombed it. Yeah, if there's anything not to say in an interview, it's definitely, yeah, I'm looking for a slower paced environment. Because usually those are trigger words to a lot of departments, especially me being an ER nurse. Anytime a paramedic would come in or a fire department would drop off a patient and be like, wow, it's really quiet in here. That's when we get bam, slammed, kind of like a full moon. Full moons are a real thing. You guys probably know. If you guys have any full moon stories, please share them in the comments below or hit us up directly. We would love to talk about it. So a side note, a lot of students get scared with interviews, and I used to until I figured out a few tricks. So if you're going to an interview, the interviewer really just wants to know a few things. So number one is, are you a team player? And number two, are you going to show up on time and really not call off? So you want to have something in your back pocket that shows you're a team player. And for new grads that don't have clinical nurse experience or clinical experience at all, like on your resume, you want to make sure, even if it doesn't relate, showing that you're a team player. So a great one was this server who only was a bartender or worked in the restaurant industry, didn't have any nursing experience, and no one does as they're becoming a new grad, right? So one of the stories that she used was a broken ice machine. And this ice machine was just out of service for weeks. And so she took it upon herself to go on YouTube and see how this ice machine worked. Turns out they just needed a little part, which they ordered for, I think, a few dollars, and it was able to fix the ice machine. So it shows that even though it's not related to clinical practice, this individual went above and beyond outside of their scope of work, wasn't paid for it. And so that just shows their initiative of being a team player. Okay, next is Zena from New York City. I was working in the ICU with a patient who had meningitis. Okay, inflammation of the meninges inside the skull and, central nervous system. He seemed calm at first, but then suddenly he started to aggressively scold her for literally no reason. I was checking his IV, I was trying to stay professional, and the next thing I know, he stops mid-rant and looks at me with a serious face and starts singing a love song. What the heck? Okay. And I mean, full performance like a love song. I can serenade you. Fly me to the moon. Okay. Then, without missing a beat, he calls me his wife in front of the whole staff. Whoa. I just stood there stunned, like, sir? So it turns out this poor guy was confused from the infection, but for a moment, I was part of the dramatic soap opera in this ICU setting. Yeah, when you have meningitis or really anything that inflames the brain, we see this a lot with urinary tract infections, UTIs, in elderly patients, or you'll see it a lot with just psych patients in general, which I worked the mental health or psych unit for a number of years as well. Um, you hear some crazy stories. It's wild. So I had a friend who was a new grad nurse, and it was around Christmas time, and she was short in stature and helping this confused patient. And this patient ended up calling her a sexy Christmas elf, which was like really weird. So that was her nickname now on the unit, like, oh, you're a sexy Christmas elf. And yeah, it just turns out that, you'll never know what confused patients will say. So one of the biggest things is that you're going to learn how to make boundaries with patients, whether they're confused or not confused. You got to maintain your professionalism and therapeutic communication, but that's one of the biggest things you'll learn as a nurse. So speaking about Christmas elves, I'm just thinking about all the Christmas cookies that you leave out for Santa. There was a patient that came in with chest pain. This patient had a very large BMI or very high BMI and lots of folds of adipose tissue. So as we're doing our assessment, we're lifting up folds just to say, like, okay, let's assess the area. We're throwing EKG pads on. We're thinking this patient's having a heart attack, right? But as we're doing the assessment, we're drawing blood for troponin, seeing cardiac enzymes, and EKG comes out fine. We're like, what could it be? So we're doing our full assessment, lifting up like these folds of adipose. And let me just tell you, I still remember this. Turns out that right under the apical area, right over here, we lift up a fold and we find a moldy cookie crumb that has been there for God knows how long. And it got so moldy that it was eating away at the tissue. And now there's an open sore and just sores around. Like imagine like that little, like the furriness of mold, like inside your fridge or like on a strawberry. It's literally was on the skin. And it was just like, oh, yeah, so basically in the ER, the moral of the story is that you'll find things in a lot of places that they shouldn't be. All right, and that wraps it up for this episode of Bedpan Banter. Please be sure to follow, share, and like our episode. And if you have any crazy stories, please be sure to comment below or send them in. And always remember, keep those vitals stable and don't let those bedpans bite.